Welcome back to Weekend Prime. A State of Devolution report by the Council of Governors on maternal and child health outcomes in the past 1 year indicates that Kenya has made strides in curbing maternal and infant deaths, with mortalities amongst the two demographics reducing by 195 and 1,132 respectively. However, while the number of these deaths decreased during this period, it is also noted that a growing number of mothers did not either attend their fourth antenatal visit during pregnancy or give birth in hospital, a situation that experts now warn could be worsened by the ongoing strike that has seen different cadres of healthcare workers, including nurses and midwives, engage their employer in a protracted industrial dispute. Here's Gloria Milimu with more on this week's episode of Health Digest.
Utilization of key maternal health services like antenatal care and hospital delivery remains a major challenge in the country, a challenge that continues to threaten maternal and child health outcomes in Kenya. A report by the Council of Governors for the year 2025-2026 shows that a growing number of expectant women failed to attend their fourth contact schedule for routine antenatal care that plays a critical role in tracking their health and that of their baby's growth. Similarly, in the period under review, many women opted not to deliver in hospitals according to COG. Governors attribute this decline to the recent transition from the defunct National Health Insurance Fund that played host to legacy programs like Linda Mama to the new Social Health Authority and reduced accessibility of maternal health services at primary health facilities.
Skilled birth deliveries dropped by 23% from 709,281 to 543,237, and fourth antenatal care ANC visits decreased by 19% from 459,489 to 368,585. This was attributed to change in policy on provision of these essential services in level 2s by SHA.
There was a policy pronouncement that our level 2 facilities were classified as not offering maternity services in the advent of SHA reforms and the like. But thereafter, we had an engagement with the head of state and the Ministry of Health where we were able to present the numbers that skilled birth is declining as a result of this because mothers had to walk kilometers and kilometers to go access this very extremely vital service to them. And this saw a policy change that was pronounced late last year, and I tend to believe this year numbers will improve.
As a country, we have made progress, but challenge still remains. Nearly about 7 out of 10 mothers who achieve the required 4 antenatal visits.
However, despite these challenges, maternal and perinatal death surveillance and response is said to have improved significantly. Counties such as Kiambu, Makueni, Homa Bay, Murang'a, Machakos and Kirinyaga are said to have reported prolonged periods without maternal deaths in the last 1 year.
Postnatal visit within the first 48 hours, we are at 78%, again on track as per the Ewene targets, and if we continue again, that target will be achieved and probably will pass or surpass the target.
Despite efforts to improve maternal and child health outcomes in the country improving in the last 1 year, experts now warn that this progress could be derailed by the ongoing nationwide healthcare workers' strike that continues to worsen. For more than 2 weeks now, nurses and midwives, who are the core of maternal and child health, have kept off their workstations, paralyzing vital services required during pregnancy, birth, and early childhood.
Today, as we talk, mothers are laboring and going through their deliveries at home and at Nyamrerwas. Children or babies who are born are going without immunization.
With no end in sight to the public health sector crisis, experts warn that Kenya's ambition to reduce maternal deaths to at least 140 per 100,000 live births and at least 12 neonatal deaths per 1,000 live births by the year 2028 could remain in jeopardy.
We are making huge investments in terms of emergency newborn obstetric and emergency care through investment in equipment, distribution to the facilities, health workforce capacity building and mentoring.
Statistics by the Ministry of Health shows that at least 15 mothers die daily in Kenya from preventable causes, as 92 newborns are denied a chance at life due to complications that can easily be prevented. And now, resolving the current human resource stalemate and addressing barriers to strengthening maternal and newborn healthcare in the country are critical steps that reproductive health experts say cannot be overlooked if Kenya is to accelerate the reduction of maternal and newborn deaths as per the UN initiative targets. Gloria Milimu, KTN.